Welcome to the Real Integrative Medicine podcast. I'm Dr. Jordan Robertson, and I'm here to bring you the tools, insights, and strategies to take your health to the next level while using evidence-based integrative medicine. What's real? This is what we want to explore together. Research is ever-changing and not easy to interpret. We're bringing you the best that integrative medicine has to offer while sticking to the facts. Our mission is to elevate the practice of integrative medicine for clinicians and patients alike. Preventative solutions, nutrition, exercise, and sometimes supplements have a seat at the table in medicine, but only if we uncover real science-backed solutions. It's time to uncover what works and challenge what doesn't. Let's unlock your full health potential with an integrated approach. Ready to learn what's real? Let's dive in. All right, guys, welcome to another episode of the Real Integrative Medicine podcast. Today's conversation is going to be a good one. You know that I care so much about evidence-based practice and helping support clinicians to get to a place where they are making really strong evidence-based decisions or decisions that are at least informed by the best evidence that we have available to us. But there is this intersection between what we find in the literature and what you may need as a unique individual with your life running in the background of how we're trying to apply support and strategy to you. And there was no better person that I could think of to have this conversation with than one of my Instagram friends, Carmen Stansberry. Carmen, thanks so much for joining me on the show today. I would love if you could open by sharing with our listeners about your practice as a very well-versed prescribing nurse practitioner in the US and what your mission is in terms of helping support women make great decisions for their hormonal health.
Well, first, thank you so much for having me. I'm just thrilled that we're able to have this conversation. I know that we've had some really healthy conversations over the years of just, where is medicine going and how can we as clinicians serve our patients in the best possible way? I spent nearly 10 years in conventional medicine, 8 of those years in OBGYN, and then 2 years in primary care. And so being very, well versed in the conventional system and having a lot of experience and insight in how women actually access healthcare. I'll speak specifically to the US, and just really understanding where a lot of the, I don't want to say necessarily anything negative, but where we are lacking and how we can improve it. And so, yeah, that is kind of, where I'm coming from and why I'm here. I can't wait to talk about it.
So tell us a little bit about your practice now, because you support women. You have an amazing and informative Instagram page. We'll put that out there and we will link that in the show notes for sure. But you have this way of helping women feel more hopeful about their healthcare journey when often they have felt like they have these blocks put up in terms of them finding answers or getting solutions. So what does it look like when people work with you right now? Like, what's the majority of your work and how are you supporting those women?
So honestly, I actually left conventional medicine in 2020, opened my own practice in health optimization, hormones, metabolic health, all of the things, taking a more holistic approach than I was able to actually do in conventional medicine. And I did that for some time, and I actually sold that practice. And now I empower clinicians to open patient-centered practices using these same pillars. And so essentially it is just that, as simple as it is, but it's just providing a more holistic experience. And so teaching women to really look at not only their medical history and their symptoms, but also really, really looking at their lifestyle. Looking at maybe how stress is impacting their hormones or how diet may be impacting their future risk of chronic disease, and just really looking at it through a lens of not only the entire woman, but our health issues don't live in silos, right? Our body is interconnected. And honestly, the root of most symptoms and chronic disease is has to do more with the immune system and inflammation than anything else.
So I would love to talk about like that term sort of like personalized medicine or individualized medicine, because sort of to start to unpack what we mean by this or what that looks like, it's like, we could write a list of 10 things that every patient should do, really, right? If we like listed them all out, there's the sleep, there's the exercise, there's the stress reduction. And yet, patients are so much more complicated than us being able to give them a list of 10 things and they just go, oh, thank you very much. And they go home and they do it. I would love to hear what your interpretation of that word, sort of individualized medicine, is, and how are you suggesting that clinicians approach individualized care right now?
I think the issue is, and you kind of mentioned it, that we can give people a list. There's a list of things that we want everyone to do. And I think what's most important to recognize is that when we kind of peel back the onion and people think that the problems they're presenting with are very unique, that a lot of it is just rooted in inflammation and lifestyle. There's so much just to get people almost to ground zero, I would say, to say, okay, are we sleeping? It's like just talking about the basics. And I think that social media has a very unique way of making everything way more complex than it actually is, right? Like you and I agree on this, that it's marketing, you guys. Like they're marketing to these needs, and truly it's, for lack of a better word, you're not that complicated unless you are actually dealing with there is pathology behind a lot of this. But when people are speaking about your hormone imbalances and all these things, it could be something as simple as you're only sleeping 5.5 hours every night. You're not nourishing your body. Your metabolic health is suffering, things like cortisol phase. You don't have cortisol phase. You're stressed, you're not sleeping, and you're inflamed. And we need to kind of focus on that. And so that is what I teach. Like, how do we get people to baseline, to ground zero, so that we are eliminating all the symptoms that we can, but looking at it through a lens that we are recognizing pathology if it is present. Is there a disease process actually happening? And that is where I say all the time, as you know, you need a licensed clinician that knows what disease looks like and can rule it out to actually determine where you need to focus, because if you have a disease process, that's completely different.
Yeah, it's interesting. We just did a session on burnout and fatigue and whatnot inside the Confident Clinician, and we're talking about how fatigue is such a difficult symptom, right? When people
Mhm.
present with,
So
and yet
hard.
when we ask patients what's going on with them, that might be one of like the top concerns that they have. But fatigue is really just it's a symptom. It's not a
Yeah,
thing
right.
itself. And diving into what's causing fatigue, and I said to the clinicians as we were talking about this, I'm like, your patient has to have tried to do the things that normally fix fatigue, like sleep. And it sounds so obvious when we say it that way, but I think, and I do think social media has had a negative impact on this, that people think that there is always a pathology, or they think there is always this secret special process that's happening in their body, when A, it's happening in everyone's body, and B, if they just like did the things that we know will fix fatigue, they actually will improve that symptom for themselves.
Yeah, that the fact that you brought up fatigue is actually so spot on. That's the perfect thing to unpack. And social media has us convinced that we need extensive, lab panels. And I'm not saying labs aren't helpful, but that's not the first step. The first step is looking at the lifestyle. And these are things that can be so patient driven. These are things you can do on your own for absolutely free, but also recognizing and educating around how much our current lifestyles impact fatigue. For example, the stress on our, nervous system, the bright light in our eyeballs as we're going to bed, the fact that we're not nourishing, we're not eating enough protein, we're not getting outside, we're not taking time to actually just let down. And that's why we're constantly tired. And so it is just getting back to basics. I don't know. Fatigue, that's a really good one. There's so much I could say. I don't want to go off on a tangent, but that's a really good example.
I know. I always thought when I was in practice that we could line up like 50 different patients who have fatigue, brain fog, and bloating, and they each will think that they have something else, right? Like one person has cortisol issues, one person has a parasite, one person has a hormone imbalance, one person thinks they have hypothyroidism, but yet the three symptoms are exactly the same. And I think, to your point around why a licensed healthcare practitioner, it makes so much sense when you're trying to navigate the complexity of your health. It's like, probably all of those things also can cause those three symptoms, but finding the answer to that is probably not coming from TikTok, or getting yourself on a path that's actually going to give you a strategy to overcome them is probably also not going to come from TikTok.
Yes. And these protocols, and then or not to, speak negatively about coaches, because coaches are very helpful. But when you are just starting your health journey, or you're having a cluster of symptoms that you're concerned about and you really want to fix them, the first place to fix them is not ordering extensive labs. It is the actual evaluation of what is going on. Because as licensed clinicians like you and I, we can look at the big picture and say, what patterns am I seeing that I've seen before? And that where would be the best place to start, rather than a $10,000 lab panel? Where am I most likely to find the cause of what you're experiencing? But I really like that example you just gave of, lining up a bunch of people that have, you name those symptoms, and I'm like, this is like 2025. Who does not have
Yeah,
these
this
three
is your
symptoms,
problem.
right? I'm like, we are all living with this, in one way or another. And so, yeah, it's, the term we use in medicine is we're looking for zebras, when what we have is just lifestyle impacts. There is not, you probably don't have a rare disease. We need to look at the big picture and know that for sure. But that doesn't take $10,000 in labs to figure it out.
No, and I think like especially for women, and I would love for you to comment on this, like who, historically have been like under listened to, under supported, under believed, right? Under everything when they approach medicine, that I don't think the women that are seeking these unique solutions or expensive panels or whatnot are gullible or don't have knowledge. I think that they actually have been so disenchanted by their regular experience in healthcare that when they see a unique and beautifully positioned, right, maybe very aesthetic offer that's put in front of them, that it actually just does give them hope, when we have really had quite a hope deficiency for women in healthcare, maybe up until that moment that they see that solution online. So I love when, we can give voice to clinicians like you, who have this very like pragmatic, practical, and like mildly conventional approach to diagnostics. So, but actually able to listen and hold space at the exact same time. Like if that existed in medicine in the first place, I'm not sure any woman would be looking for solutions on the internet.
100%. That's the thing, is if the conventional system wasn't failing women, we wouldn't be here in the first place, right? However, the caveat to that is the one benefit that I think all these lab tests and this availability and accessibility of data is very empowering for women. There is no gatekeeping anymore, that, we can go online and we can find a way to do lab tests that give us some type of data about our body. And that is why I won't necessarily vilify. If you want to do a Dutch test and you want to spend the money and you want that information and you're going to do something with it that's meaningful to you, I'm not going to say that that's wrong. I think there are a lot of, benefits to that. I think that women are feeling more empowered than they ever have. The struggle is when, one, a true diagnosis is missed. That's a problem when you actually have something going on, and you don't get help from the conventional system, and then you get taken advantage of on the other side, where you're looking for information and help and not just data.
Yeah. And I would say the other side of that too is I always am worried when people are getting a diagnosis that isn't, right? Like there's almost like
Mm-hmm.
both sides of that. The way I like to think about labs or is like, in theory, when we give people medication, we know that there's like a success rate with medications, right? Like if we give you an antidepressant, it has an X amount of likelihood of helping you feel better or not feel better. And lots of labs have some of those same stats, right? They have a probability of diagnosing you, and they also have a probability of missing you, and they have a probability of misdiagnosing you. And, one thing I'm always so curious about with this like rapid adoption of like point to consumer lab work is like, are we going to overdiagnose people with things they don't have, or over label them with things that then influence the way they, eat, or influence the way they exercise, that actually is maybe not true because we've like applied labs and without context, right? Like if you can do mail order parts of your medicine and don't have a great relationship with someone who can see that through, or that through line, there is that likelihood that we get a label that we don't need. And I always worry that, 10 years from now, we're going to have overdiagnosed women with something. But I'm curious about where that's all going to go.
I mean, honestly, I am too, because of this, polarization of they go to conventional medicine, they don't get answers, but then doing these lab tests and then they get a printout of all the things that are wrong with them. And whether those things are clinically significant is the question. Is this data clinically significant to you? How much is this going to actually impact you today and long term? And that's what I think is missing.
Totally. Yeah. And we can, if you're listening, people probably think, well, isn't every test clinically significant? And like the answer is
No,
no, right?
absolutely not.
Yeah, we can have something that's bold or flagged or green or purple on your lab work and it never have a meaningful outcome in your health. It doesn't impact death or cancer risk or anything, yet it's kind of flagged. So it's an interesting piece because not every single test or assessment or quiz that you do for your health is actually going to change the journey that you're on, whether you act on it or not. And I think that's where having a practitioner who's able to decipher that for you is so valuable.
Well, and I think that's where we could get into the conversation about screening, right? Everyone wants screening, but they don't realize that over screening and over testing can actually be harmful, because we start digging down a rabbit hole and we're finding data that's meaningless without subjective, data attached to it. And so what I mean by that for people listening is, if you are, like Jordan said, if you're checking labs and we see a red flag, it's all lit up in red and it's like, oh my gosh, what's wrong with me? I have an abnormal lab. But Jordan and I can look at that lab and say, there's nothing clinically significant in this picture physically or in the presenting, investigation that makes this lab meaningful, or gives us any indication that we need to dig any deeper. And that is the problem when you're getting these lab results and they're either being interpreted by a coach or not being interpreted at all. They're
Mhm.
just given to you with a PDF printout without that context. We're more likely, honestly, to cause stress from meaningless information than we are to pick up a lab and miss it. If something's lit up on your lab report, we're likely not missing anything. Would you agree?
Mhm. Mhm. Yeah, and it's funny, it made me think of like when we ask people if they want to do their genetic testing about anything, we have like an element of curiosity about whether or not we would do something with the info, right? Like, do people want to know? And I think we've learned that there are benefits and harms to knowing and understanding our genetics. And I think patients can more easily think about that one and say, you know what, I don't want to know if I'm at risk for dementia. Like, I'm happier just living my life the way I am. I'm going to do my best. And if I get it, I get it. But then they don't apply that same kind of sort of critical thought to some of the online available tests that are looking at things that feel more topical, like cortisol or hormones. But yet we should actually use the same level of critique around some of these point to consumer labs to say, is knowing anything on this report actually going to change anything for me? Do I need to know? Is it like relevant for me to know? Am I going to change my life if I know? We're running them without doing that sort of like dialogue in our head, where with genetics, we are curious about whether or not there's harm if we learn, right? Our genetic story. But we're not doing the same thing with other tests. And in theory, we can cause the same kind of harm if we, assign you a diagnosis or give you a label that is irrelevant or not helpful. We can still cause the same level of stress or worry by doing labs that are not necessary.
Yeah, I think another way we could look at this is, I know like I'm just going to use the example of people that might say, I feel like I had quite a few patients that would say, I have a family history of colon cancer and I'm 28 and I want to get a screening colonoscopy. And they think in their head it's harmless. Like, what harm could it be to look early and get these, this imaging done and just know that I don't have cancer or precancer? But what they don't realize is, just one, there's the risk of anesthesia, getting a colonoscopy for one. There are risks because it's a surgical procedure. But not only that, there is risk of looking for things. There's risk to screening, because what if we look and we see something that's not clinically significant? Okay, you have a mass. It's benign, but we need to watch it. And it may have never resulted into anything, but because we looked, we had to document it. We had to follow up on it. And not only did it cause an immense amount of distress to the patient, but it also caused more unnecessary testing down the road. And that's where, we could have a whole conversation just on where this is going. The more data that we get at our fingertips, the more over screening we're going to be doing. And this is kind of the same argument around all the screening MRIs. What is the actual clinical significance? How much disease are we actually picking up? How much sensitivity is actually there from a research standpoint, that we're going to actually pick up disease rather than ruling it out? What do you think?
Totally. They changed some of the, and they've gone back and forth with some of the mammogram guidelines in Ontario, where I live, over the years. And when they had decreased the frequency of mammograms, everyone was up in arms, because they're like, oh, they don't want to catch our cancer. And it was like, no, 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 we were just doing biopsies and everybody, and nobody needed those biopsies. And so it's usually, when we make changes to those screening guidelines, and like the big screening guidelines, it's because we're acknowledging or recognizing that we were over treating or over poking people, because we were picking up things that weren't meaningful. And then when they changed the screening guidelines for now, women over 40 can go for a mammogram, people were up in arms saying, well, now they're doing unnecessary tests. And I was like, no, no, we realized that if we bring this test in at this moment in time, we can catch clinically meaningful, aggressive breast cancer in young women. So by screening all of you people, we are catching disease at a really important period of time for some of you. So that's the thought process around screening. But then applying that to when you can just order the test, or a health coach has recommended the test, is so important, because in theory, we should be using kind of the same thoughts around whether or not we do or don't do it, to try and avoid harm, but also catch disease at a meaningful moment. Yeah, I think it's such an interesting point, because personalized medicine brings in this idea of like personalized lab work. And the more unique your plan gets, almost the less evidence-based it gets, actually. Like, the more unique of a snowflake we are drawing for you, the less we're relying on some of our, like, honest to goodness statistics around whether or not it's a relevant plan. But I'd love to hear what you think about, like, that intersection between evidence-based medicine and personalized medicine, Carmen, because we've had some great dialogue over the years, you and I, about this, and like, how do we get clinicians and patients to kind of meet in the middle around this discussion?
I think that kind of where we started this conversation around, how much is actually personalized, how much is really unique. And I think that the internet has this way of making us think that these unique disease processes and diagnoses are more common than they actually are. For one, out of, how many thousands of patients, what is the actual true incidence of some of these things? So, for example, I will say elevated cortisol. Let's talk about Cushing's disease, for example. How often are we going to see a cortisol, like an actual serum cortisol, that is over the limit, that is warranting further investigation into Cushing's disease? Hardly ever. I think I've seen it twice in my entire career. The rest is fluff. I'm going to say it. The rest is fluff, right? And it's not, you don't need an endocrinologist because your Dutch test said your cortisol, or you have burnout and your adrenals are taxed. It's just a totally different thing. And so I think there's so many ways to look at this. I think that it's hard. I think that people think that medicine is more personalized. And I think the more personalized you actually want it and the answers that you're looking for, the more vulnerable you are to receiving snake oil, quite honestly.
Yeah, I think that's so true. It's funny, you're right. Like we all want to believe that we're like this special, unique flower, but like most of us just need to go to bed.
Yeah.
Um,
So
and I agree. It's like, you know, usually when I'm talking about the way we make decisions in medicine, I think about it like betting, right? Like if you're at like a horse race and there was this, you know, big, beautiful stallion that had won a million races, and then there was this like brand new little pony, but it had a cute saddle and it has a nice name. And we said, okay, you got to put $100 down. Like, which horse are you going to bet on? You know, you're going to bet on the stallion, right? You're like, all right, this one's won before. Like, this pony's never even raced. I don't even know if he knows what he's doing. We're going to bet on the horse that looks like it's going to win every time. And when we're trying to make decisions in evidence based medicine, that's kind of what we're trying to do as well, right? We're trying to say, this has been repeated. This has been shown before. This one won the last time. This is the one that most people have put their money on and they've all won money on it. Like, put your money over here. But the internet has this way of making it sound like the pony, this underdog who no one's seen before with a cute pink saddle and a really adorable name, is the secret to your success, right? Like this one's actually the right one to bet on. This one is unique. This pony's here just for you. And yet you would never put money on that pony in real life. You would never bet on it. You'd be like, that's adorable, but I'm going to bet on the stallion.
And
And
sorry.
no, go ahead.
And that they're the only ones that know that that pony's going to win.
That's right. Yeah, that this pony, no, your doctor doesn't even want you to know about this pony, but here he is.
Yeah, they want to hide the fact that this pony is going to win so that, you know,
it's a conspiracy.
It's a conspiracy against you. Yes, that you are not going to win and that they're, yes, exactly.
But that's like, as a clinician, this is what we're trying to do, right? We're trying to stack up odds and statistics and have you bet not with your money, well, often also with your money, but also with your health, right? We're trying to bet on your health. And so we're trying our hardest to stack the deck in towards the thing that's going to win the race. And it's not because we don't love the pony and we don't think it's adorable, but it's because it's not a tried and true recipe for success. And that's like a great and easy way to put it. Sometimes weirdly, we still bet on the pony when we're at the racetrack, right? Like we feel bad for it. And so we still put our money on it. Right? Or it's like it has the same name as your grandma. And so you put your money on it. And sometimes we honestly make health decisions that way too, right? Like the person in the cubicle beside you bet on that pony. So you're going to give it a whirl. Or your favorite influencer on Instagram uses that pony. And so you're going to try it too. We have to be so mindful of like what influences our decision making in medicine, because that draw to being special and unique and innovative and that it's a secret and no one's told you about it before, it can overshadow betting on the stronger horse.
And what happens when you bet on the pony is you lose money. And that's, you know, that's kind of the root of this, is that what is worth putting your time and energy into, and then ultimately money. Where are you spending your healthcare dollars? And if you want to keep betting on the pony, then be prepared to lose. And I think that these are stories that you and I have heard over and over of, I didn't get the answers I wanted. I went here, I got all this testing. Can you look at it? What is meaningful here for me? Or worse off, they go forward and they try all the supplements and try all the things and they don't feel any better, you know, because turns out none of this was meaningful. They actually were just in a really bad marriage and it was making them not feel well. And so, you know, I think that there are so many angles to look at. It is the, you know, trends in wellness, like you said. If your best friend is trying something, and so I'll use colostrum as an example. Your best friend's trying colostrum. They're swearing it's healing their gut and they feel amazing and you're going to try it too. Is there anything inherently wrong with that? No. If you want to try it, you know, I don't think anyone out there is going to say putting colostrum supplement in your, you know, water is harmful. However, you know, are you doing it because your friend is trying it and you want to try it? Or do you really think it's going to do something meaningful for you?
Yeah, it makes me think of like when health is someone's hobby, like let's say they're like 90% well
on most given days, and they're looking for that like 1% improvement. Maybe I care a little less if they like muck around with a bunch of innovative, interesting, albeit understudied ideas. The challenge is that women have like real challenges that are causing real lost days of work or real disability or real relationship problems or real pain. And we're like almost looking at health hacking and hobbyist health changes as a solution for those real problems. And I think my answer changes a little bit if people want to muck around with a few different, innovative new ideas in health without trying the tried and true evidence-based solutions, but they miss 5 days of work per month. Like, I think I have a bigger problem with that. I don't know, maybe that's my bias, but I have a bigger problem with that because it's like the stakes have gone up. And so, in my opinion, I feel like the science needs to go up with it.
I don't know if this is you or not, but if you're a naturopathic doctor or an integrative practitioner who prides yourself on being evidence based, but don't have time to stay up to date with the research yourself, I have a solution for you. I'd love to invite you to explore and join the Confident Clinician, the only integrative medicine clinical decision making tool that helps get research from PubMed into your practice with ease. We have built out exactly what you need to be the most efficient in your work, to be the best in your community, and to save you those precious hours that you're spending right now doing the research yourself. Joining with our premium membership gives you access to unlimited AI searches, gives you access to all of our previous database content, as well as our upcoming year of live delivered modules. You can check out more in the link in the show notes. I would love to see you inside of our community. We're making a huge difference in the way that practitioners practice integrative care and raising the bar for evidence-based integrative medicine. I hope you'll join us.
Yeah, I think you make a great point. I mean, and again, this is the difference between discerning, do you have an actual pathology, or are you feeling actually generally well and you're just looking to optimize? And these are two totally different types of women, right? Not to put people in categories, but there are some very sick people out there, and if someone is really sick and dealing with complex issues and complex symptoms and things that need a more longitudinal approach and they are trying to fix it on TikTok, that is a huge problem.
I would love to hear, and not to have a slight digression, but I'm glad that you brought up the word optimization, because I do think that sometimes that word gets misplaced in the care of a sick person. And when people still have real symptoms and significant symptoms that are impairing their quality of life or their risk of other disease. And you're right, there is this other like category of health, I call it like health hobbyist, right? Where it's
Yeah.
like they're doing things on top of feeling generally well. But how do you define health optimization? Like, what does that look like to you and to your patients?
I think the difference is that one, someone who's truly sick has a diagnosis or is going through an evaluation for something fairly serious, right? And that's probably where everyone starts. Health optimization is not for that person. So we'll use, perimenopause as an example. There is a difference between a perimenopausal woman showing up who has gained 15 pounds, can't move her wedding ring, feels puffy all over, can't get out of bed in the morning, and maybe is now having new onset joint pain, for example. That person is not a candidate for any type of health optimization. We need to figure out what's actually going on. This is a red flag for me for needing an autoimmune workup. Really looking at, and that's the other thing too. This is not I'm 45, I have these symptoms, it must be perimenopause. No. And that is, again, where the nuance of women's health on social media and everywhere else is like, no, we actually have to figure out why you've gained 15 pounds, why your immune system is acting this way. Why are your joints hurting? Is it because you just have perimenopause, or is it because you have rheumatoid arthritis? What is actually going on with you? And so that type of patient should not be looking for health optimization at a med spa, for example. They need an actual workup. And I think, again, this is where social media is actually diluting our healthcare, because we're oversimplifying things that should not be oversimplified.
Right. Just do a castor oil pack, and I'm sure all
Yeah,
of those things will go
everything
away.
will
Yeah.
go away. Exactly. You just have inflammation, quote unquote. Well, it's not that simple. And again, there are, even when I think about the diagnosis of rheumatoid arthritis, like, this is not easy stuff. Rheumatology is actually very, very complex. And again, it takes lab work. There is no rheumatology lab that's black and white that says, yes, you have this thing. It is the clinical picture, the symptomology, the medical history, and the patient sitting in front of you, and the story that they're telling is where these diagnoses come from. And I think, again, this is where we get into trouble with social media. This is not a person, again, that, it just needs a pellet and they're going to be all better. They need a medical evaluation first.
Don't they just need 2 pellets? No, I'm just kidding.
They just need estrogen and testosterone.
And now all their problems are solved.
Yeah.
Um, I think this is such a great conversation because for me, and sometimes when we're working with clinicians and we talk about like standards of care or guidelines or playbooks, in integrative medicine, we can sometimes feel threatened by this idea that there's like a bit of a playbook or some rules that is rooted in evidence, because it's almost like I think clinicians feel like it's like bastardizing, individualized or integrative medicine, where we've always taken this stance that we listen to the person and we apply a unique solution to them, yada, yada, yada. Whereas I'm very much of the mindset that like, the individualized care is more about helping apply the evidence strategically to your unique patient versus cherry picking unique solutions to give to your patient. And my example I always give is like, if your patient has insulin resistance, and if this patient has insulin resistance and this patient has insulin resistance, and this patient is like single and they work 9 to 5 and they have access to a gym and they like to cook, their answer for how to manage their insulin resistance might look a little different, or their strategy will look different than this person who works night shift and has 3 kids and is a single mom and doesn't have access to fresh fruits and vegetables. In theory, the evidence says we should do the same thing for both of those people to achieve the same outcome. But as the strategist, right, we apply that evidence through the lens of like, what is this person able to access right now? What is the priority for this person right now? What other conditions do these people also have? And that's what I would love for us to get to in integrative medicine, where the clinician knew the evidence for the thing to say, here's how we can support insulin resistance. But my role now is how do we implement it given the uniqueness of my patient's life? Not that this person with insulin resistance gets, treatment A, D, and F, and this person with insulin resistance gets treatment B, C, and J. That's how I've always viewed it, but I'm curious what your thoughts are on that. Like, the standards of care kind of have so many problems with them, and yet we still require some guidelines for how we approach care and medicine, in my opinion. But what do you think?
Yeah. And I actually love that you bring up the word strategy, because I use the term clinical strategy a lot. And what that means is, it doesn't mean that we're bending the clinical evidence in our favor. It doesn't mean that we're like picking these very specific treatments from all of this vast evidence, that it's so personalized that we're going to get better results because we choose A over B. It is saying, looking at that patient sitting in front of you and their lifestyle, like you just described, and saying, how can we use the data that we have and these proven treatments through clinical evidence and apply it to your life in a way that we can get you feeling better in the most efficient and fastest way? That is the clinical strategy, to say, we're not bending the evidence in our favor. We're going to use the same proven treatments, but we're going to apply them maybe in a different timeline. Maybe we're going to start with A and B comes next, or you're going on vacation. And so we're not going to focus on nutrition. We're going to focus on this other thing. But the end goal is always the same. And the major pillars that happen along the way are also the same. We might just stagger them differently or stack them differently, but it doesn't mean that we're bending the evidence. And it definitely doesn't mean you're getting a specialized insulin resistant plan, because we know based on the evidence how to help with insulin resistance. And honestly, we're going to go back to this. It's actually more simple than the internet makes you think it is. It's actually so simple. And this is where, when it comes to getting to baseline, and this is also when choosing a clinician, you need one that's not looking for all these different zebras and trying all these different things, because all they're going to do is bleed your wallet, honestly. And looking at the basics. The other thing that I always recommend is, and I do in my own practice, is educating patients on, this is the evidence that we have. This is the gray area that we have. Where do you feel comfortable? I can tell you that we can try this. I actually have no evidence it's going to work. And this is where we get into the complexity of women's health and the lack of research that we actually have, right? There is a lot of lacking research. We only have what we have to work with. And so to say, there's very limited data on this, or I've seen this anecdotally work in my practice, but I really can't tell you this is an evidence-based solution. And that's kind of how I like to approach it. I think that this is built through relationships. And this is where I see the silver lining of medicine going, that healthcare can actually improve. And it's through relationships and through actually finding a partner that's willing to do these different strategies with you, but not stray too far off into, not a place you want to be.
Yeah, we say often to our clinicians that the visit is part of the treatment, right? Like the visit is the treatment. It's not just the list of things or the list of prescriptions. Like the visit is the treatment, actually, because that relationship and having the ability to strategize with a patient. And we said eat bananas, but turns out you don't really like bananas. Okay, great. Like we'll strategize. That's really what that healthcare experience should feel like. And integrative medicine, even if we're literally just doing the guidelines as written, and maybe we have lots of evidence for how to do something, and we're executing those guidelines as written, we're able to do it in such a beautiful way because we have the time and capacity for relationship-based care. You may have heard the same message from your endocrinologist in a 5-minute visit. Having it hashed out over 50 minutes with someone who deeply cares about your compliance and your life and all of those things, that lands so much differently, even though the answer, quote unquote, was exactly the same. So I find that that's such an important piece because, again, for integrative clinicians, sometimes if we are playing by the same rule book as conventional care, we can question what our worth is. I'm like, no, your worth is in the time and the relationship and what you bring to that table, because the endocrinologist doesn't even have time to sit at the table, let alone have a deep discussion with patients how they feel.
Yeah. And this is what I teach clinicians that I mentor in business, is that if you are selling a commodity, if you're selling a treatment, you are not going to be in business very long, because there are so many ways for patients to access treatments, right? And if they're not looking for the experience and they're getting that treatment in conventional medicine, say, it's no different. It's the same exact thing. And we're seeing this big shift because the consumer is changing. They want a different experience, not a different treatment. They want a different experience. And this is the trouble with all these fancy labels that we put on everything. Functional medicine is not superior to conventional medicine. I think it's the premise behind it, that we take the time to listen to get to the quote unquote root cause. But if you're practicing what you're calling functional medicine, and you're still very problem focused, and you're not actually, taking the time or providing that education and coaching and actual relationship and connection people are looking for, you're no better. It's no different.
Yeah, it's so interesting. Like if I ever had people shadow in my office as a clinician, they would be shocked at how many times I worked with patients and never prescribed anything. They're like, you didn't change anything in their plan. I'm like, no, because it's the same stuff that they need to do from the last time we talked. Today was about the talking.
Right. Exactly.
Because we don't necessarily need to prescribe something every time we see patients. And sometimes patients actually have that expectation. They're like, well, can we add something to my plan? And I'm like, no, just do the things that we talked about last time. You brought up a good point there, Carmen, about the research on women's health that I wanted to circle back to, because I agree with you, and I love that you use that term bend the evidence in our favor. I am 100% borrowing that because it's common that when something new comes out, we get excited or we feel like it's really flashy. When there's something that's innovative or that seems like a new big deal, we sometimes forget to compare it against like the body of evidence we had before that paper was published. But one of the things I think is so interesting about the discussion about research on women's health is that there are still a lot of conditions that women suffer from that are not sex dependent. And this narrative that there's not a lot of research on women, that they kind of like we've almost forgotten that like lots of women's health is actually not sex dependent, and we can treat women for rheumatoid arthritis, or we can treat like certain aspects of women's health knowing that we have research, like large bodies of research on all people, and that research still applies to women. And then also, and this is where I'm curious about what your thoughts are, it's hard to separate hormones from health in women because it influences so much of how they feel. So that discussion there around like, do we have research on women? Do we have enough research on women? Yeah, I'm curious about what your thoughts are there, because not everything is sex dependent, but also it's so hard to separate the difference between sex hormones and how women feel, even if we're talking about insulin resistance.
This could be an interesting conversation because while we say research isn't sex dependent, how do we know that if we don't have the research, right? And so we can sit here and split hairs, and that's not what we're going to do for the purpose of this. However, the way that women's hormones interact with the immune system is different than the way that men's hormones interact with the immune system. And that is why women are much more prone in the prevalence of autoimmune disease, for example. And when I look at a woman through the lens of, ultimately what most people end up dying from, right, is not hormone imbalance. It is insulin resistance causing cardiovascular disease of some sort, right? Be it heart attack, stroke, and how prevalent that is, or cancer. All of these things, if you pull them together, are rooted in inflammation. And it's women are different. And so that is the area of research I would like to see. It's not that I'm saying that the, research that we have on heart disease and what the research that we did on men is that much different or nuanced. I truly couldn't even tell you that I'm that well versed in that body of research, but I do know, and from what I've seen, that women are different.
Yeah, I would love to see more there too. I think what I was thinking there is that sometimes when we talk about the lack of research on women, we use that as a reason why we should use a novel solution that's
Mhm.
never been tested before, when not everything that women walk in the door with needs a novel new solution, because we do have big bodies of literature that have been studied on men, and not every single treatment needs to necessarily be sex dependent.
Mhm.
But you bring up a really great point, is when we look at like the root of baseline risk, or the way that those pathologies emerge, say in menopause or perimenopause, is sex dependent, even if even if in theory it's still heart disease and men still have heart disease. It's more for me, as I'm thinking about like in this moment in evidence-based care, saying we don't have research on women isn't always perfectly true. We have some research, and we don't always need to only have research just on women to know how to get started with people. And not having a study that's just on women, just looking at sex changes in with respect to a condition, doesn't mean that you should listen to TikTok. Right? It's like, it's not like we swing the pendulum so far to say we have zero idea what to do with you women because we've never studied it. Like that part I find a little bit of a stretch. I think that we can use the research we have, and we can deeply desire more research that is sex dependent. Does that make sense?
Yeah, and I think the takeaway here is exactly that. The point that you bring up, that the takeaway is that we want more research in women specific conditions, right? And the outputs, for example, women with PCOS that don't ovulate, we know are at higher risk for cardiovascular disease diabetes, and that puts us at long-term risk. And so how do we capture those women at earlier ages and actually intervene appropriately to prevent that? Does that mean that we don't know how to, treat heart disease because it was caused from not ovulating earlier in life or these additional risk factors? And so that, I think, is a takeaway, that we both agree that we need more women's health research, and that's the bottom line. And that's actually the end of the story. The story is not, we don't have enough research, so let's try this novel thing over here. And because I've seen it work, and even though we don't have the evidence, we have to go forward with it. Or we need to stand in front of a green screen and highlight this new research article that came out and let you know that these are all the new things you can do, and how now you can buy what I'm selling because this one article is highlighting, information that we didn't have before. There's a lot of manipulation also, to your point, of data, of saying, look at this new thing, and I can actually show you. We have the study of 30 people, which, for those that don't know, that's not very strong research. That's more of a, just a tidbit that we can share, but it's not going to create new guidelines in medicine.
Yeah, I think I would love for you to summarize for us, Carmen, as we wrap up the episode, is I think you do such a great job of empowering women to keep looking for a solution, but let's have that solution be rooted in science, right? Which that's, one of my favorite things about you is that it's you're able to sit in the nuance of women's health has been a little underwhelming up until this point, but also let's use good science, good diagnostics, good research, good outcome measures to track if the solution is being effective. And I don't see that happening in lots of spaces online. We say, women's health has been underwhelming thus far, and therefore we need this never been proven before solution, or it's a manipulation to give you a new diagnosis that didn't exist in 2024 because we're trying to sell you something. You have this ability of capturing the essence of the way women feel about healthcare, but presenting them with a solution that is actually rooted in evidence. I would love if you could just share, some words of wisdom for our listeners, how they can get started if they are feeling a little underwhelmed by their healthcare experience, and how our listeners can find you.
I think the biggest thing that we need to remember as clinicians is that we need to trust women. We need to trust women to be able to navigate this information on their own. And that's part of that empowerment is so important. And even if we have a patient that is, comes into our practice and leaves it shortly thereafter, or if it's someone we have this lifelong relationship with, that we need to give women the space and trust them in what they're doing. Because I think a lot of what's happening is we see them consuming different things and then we start to guilt them. But as the woman seeking healthcare, and my best advice is not to take anything too literally that you're reading on the internet, and really, I think one of the ways I empower women through my platforms is I want you to look at this and see it as marketing, because that's all that it is. Look to see, what is this person trying to sell you? And even more so, what is it they want you to believe to be able to sell you this? And this is rooted in marketing psychology, right? That not only are they trying to sell you something, but the step up from that is, what is it they're trying to get you to believe about your body, about your health, about women's health in general, about politics, about, anything, so that they can sell you something. And just be very discerning about, why is this person wanting me to believe this? And why am I going to believe them? What credibility do they have? I see a lot of this online, and I know you do too. And I'll admittedly tell you, I get very triggered by people speaking on things they know nothing about. People have a way of building this authority online, and then you look maybe on their LinkedIn and you're like, you have no education, you have no credibility to be talking about stuff like this. And so, yeah, just, I hate to use the term doing your research, because that I know that
That
you're gonna,
triggers me.
yeah,
So
I know it does. Yeah, I just am doing my own research. Yeah, okay. But doing research into the people that you're choosing to believe. And I think this is getting harder with AI. People, there's so much, like, I don't want to say deep fake because it sounds so extreme, but it is. There's so much. I mean, you can plug inputs into AI and get healthcare advice, and people are utilizing that to sound much more intelligent than they are. And so that is my best advice, that who you are aligning your belief system with, not, what you're buying, but actually what are you believing about your body and your health, that is either harming you or helping you.
I love that. That's such a great takeaway. And it's a good reminder to take that sort of like back up and think about this interaction in a different way, because that, like, we want good value driven relationships in healthcare. And if you're finding yourself getting pulled in a slightly different direction, or if you're feeling like something is new or innovative and that's feeling exciting to you, even asking yourself why that's happening, because sometimes that can unlock or open up for you what it is that you're so disenchanted with in your current situation. And maybe it's not the new novel thing that you need, but maybe it's someone who listens. Maybe it's not the new novel thing, but you need strategy to be more compliant with the treatment plan you already have.
Yes,
So these are
exactly.
such great advice. And we'll put the links for your Instagram, Carmen, and your website on the in the show notes so people can have a quick follow, which I highly recommend. Thank you so much for spending time with me today and for giving our listeners such insightful information about how to navigate their health.
Thank you so much for having me. It's such a great podcast, and the work you're doing is so incredible.
That's it for today's episode of the Real Integrative Medicine podcast. I hope you're feeling inspired, informed, and ready to make changes that truly support your health. If you found value in today's discussion, don't forget to hit subscribe, share this episode with someone who needs it, and leave a review. It helps us reach even more listeners just like you. Your health journey is personal and it's powerful. Let's keep building on the knowledge to give you the confidence you need to thrive. It's important to remember that the Real Integrative Medicine podcast is for educational purposes only. Be sure to talk to your doctor before making any personal health changes. This podcast isn't intended to diagnose you, and no doctor-patient relationship was formed by listening. We'll see you next week.